Hello everyone, myself Shubham Agavne and my partner name is Nilesh Gurav, student of Ashokrav Mane Institute of Pharmaceuticals Science and Research Save. This video is cared by Mr. A. N. Dhagesar. Subject Biopharmaceutics and Pharmacokinetics, BP 604T. Previous year question. We are presented by the explain mechanism of renal excretion. State the equation of renal clearance. List factors affecting renal excretion of drugs. Mechanism of renal excretion. Almost all drugs and their metabolites are excreted the kidney to some extent or the other. Some drugs such as gentamicin are exclusively eliminated by renal route only. Agents that are excreted in urine are water-soluble, non-volatile, small in molecular size, less than 500 Dalton, the ones that are metabolized slowly. Mechanism of renal excretion. A. Glomerular filtration. B. Active tubular secretion. C. Active or passive tubular reabsorption. This three process depends on below diagram. See in diagram. The diagram illustrating process involved in the urinary excretion of drug. Excretion through kidney occurs by C in left side, first, glomerulus, second, proximal tubule, third, active reabsorption, fourth, loop of Henle and distal tubule in glomerulus, C in right side. First, glomerular filtration of water and unbound drugs are metabolites. Second, active tubular secretion of acidic and basic drug and metabolites. Third, active reabsorption of acidic and basic endogenous compound and passive reabsorption of lipophilic drug in proximal tubule are occur. Fourth, the urinary excretion of drug and metabolites that are filtered and or actively secreted and not reabsorbed are excreted through distal tubule. Glomerular filtration. It depends on a plasma protein binding only unbound from is expected. The drug which is plasma protein binded can't be filtered. It is non-selective, unidirectional process. Ionized or unionized drug are filtered except those that are bound to plasma protein. B. Renal blood flow. Glomerular filtration rate increase with increased renal blood flow. Out of 25% of cardiac output or 1.2 liters of blood per minute that goes to the kidney via renal artery, only 10% or 120 to 130 ml per minute is filtered through glomerular. Active tubular secretion. Two types of pumps present in proximal tubules. One is for acidic, other is for basic drugs. Acidic pumps secrete the organic acids. For example, penicillin, salicylates, uric acid, etc. Basic pumps secrete the organic base. For example, morphine, mecamylamine, hexamethonium, etc. This process mainly occurs in proximal tubule. It is carrier-mediated process which requires energy for transportation of compounds against concentration gradient. B. Only one drug can pass at a time. Means two drugs are the acidic in nature. These drugs are the high affinity gives pass in firstly. Rate of excretion greater than the normal glomerular filtration rate, for example penicillin. Active or passive tubular reabsorption. 99% blood comes back through the reabsorption process. It depends on A. Lipid solubility. Non-lipid soluble drug are excreted more means the water-soluble drug are fast excrete out to body. Purpose of metabolism is to make the drug water-soluble so that it can be excreted. B. Ionization of the drug. Highly ionized drugs are excreted more means that the rate of ionization is more to the drug are excreted to more amounts. See urinary pH for partially ionized drug. Basic drugs are ionized more on acidic pH and less reabsorption. Acidic drugs are more ionized and reabsorption less in alkaline pH. This process occurs after the glomerular filtration of drugs. Reabsorption results in increase in the half-life of the drug. Equation of renal clearance. Definition of renal clearance. It can be defined as volume of blood or plasma which is completely cleared of the unchanged drug by the kidney per unit time. It is expressed mathematically as renal clearance is equal to rate of urinary excretion upon plasma drug concentration. Physiologically speaking, renal clearance is the ratio of sum of rate of glomerular filtration and active secretion means rate of reabsorption to plasma drug concentration. It is expressed as renal clearance is equal to rate of filtration plus rate of secretion minus rate of reabsorption upon concentration. Ratio of renal clearance. It can be comparing the clearance values obtained for a drug with that of an agent such as creatinine or inulin which is cleared by glomerular filtration only. The ratio of these two values is called as renal clearance ratio or excretion ratio. It is expressed as renal clearance ratio is equal to renal clearance of drug divided by renal clearance of creatinine. Factors affecting renal excretion of drugs. Apart from the three physiologic processes that govern the urinary excretion, other factors influencing renal clearance of drugs and metabolism. This factors gives as a follow. 1. Physicochemical properties of the drug. A. Molecular weight. B. Lipid solubility. C. Volume of distribution. 2. Plasma concentration of the drug. 3. Distribution and binding characteristics of the drug. 4. Urine pH. A. Weak base, pKa 10. B. Weak acid, pKa 7.4. C. Weak acid, pKa 3.5. 5th blood flow to the kidney. 6th drug interactions. A. Forced diuresis. B. Alteration in urine pH. C. Alteration in intrinsic clearance. D. Alteration in renal blood flow. E. Alteration in binding characteristics. F. Alteration in active secretion. 7th disease states. 8th blood flow to the kidneys. 9th biological factors. 10th pregnancy. 11th drug renal clearance. A. Diseases that decrease renal blood flow. B. Disease that decrease renal excretion. Thank you watching for video. Keep support, like and subscribe the channel.